Vanishing white matter disease is a rare genetic disorder that is passed down from parents to their children. It primarily affects young children, and it causes progressive neurological and motor problems. Because it is chronic and gets worse over time, early understanding and diagnosis are incredibly important. Vanishing white matter disease is a condition where the white matter of the brain slowly breaks down. White matter is essential for communication between different parts of the nervous system. So when it begins to disappear, a child starts to lose important abilities, like movement and coordination. VWM is caused by mutations in a group of 5 genes, EIF2B1 through EIF2B5. These genes make a protein complex called eukaryotic initiation factor 2B, or EIF2B. EIF2B plays a major role in protein production, which is necessary for healthy cell function. Because this process is essential for life, when these genes don't work properly, white matter in the brain becomes extremely fragile. A major feature of VWM is that symptoms often worsen suddenly after stress events such as fevers, infections, or head trauma. Once triggered, white matter deterioration can progress very quickly. VWM follows an autosomal recessive inheritance pattern. This means both parents must be carriers of the mutated gene. Carriers have no symptoms. A child must inherit 2 copies of the mutated gene, one from each parent, to have VWM. If a child receives only one mutated copy, they do not develop the disease but can pass the gene to their own future children. VWM is typically diagnosed using 2 main tools. 1. MRI scans. Doctors look for the characteristic appearance of vanishing or abnormal white matter. 2. Genetic testing. DNA analysis of the EIF2B genes confirms whether the gene mutations are present. Most children are diagnosed between ages 2 and 3, and only about 15% of cases are diagnosed after age 18. Symptoms of VWM can vary, but common features include muscle stiffness, loss of motor skills, neurological deficits, spasticity, seizures, lethargy, or extreme tiredness. These symptoms worsen over time, especially after stressful or triggering events. Currently, there is no cure for vanishing white matter disease. Treatment focuses on supportive care, such as medications to control seizures, occupational therapy, physical therapy, strictly avoiding triggers like fevers and head injuries. Care teams work to improve quality of life and slow symptom progression as much as possible. In conclusion, vanishing white matter disease is a rare but severe genetic disorder that affects children's neurological function. Although there is currently no cure, ongoing research, supportive care, and increased awareness offer hope for better treatments in the future.